Welcome back to Great Day. We often talk about how men won't go see the doctor until something is really wrong. All right, so was it hard to get your husband to go to the doctor?
Yes, it was.
Yeah, all right. What about yours?
No, it wasn't.
Oh, okay. Well, maybe y'all should have gotten together on that.
Yeah, maybe should have.
Yeah, okay. Well, guess what, ladies? We're guilty of it too, always putting the family first. Genesis Medical Group makes things easy because at the same time they can focus on your kids' health, they can take care of mom too. You can even add grandma and great-grandma to the mix. Dr. David Ellett and Farshonda Williams with Genesis Medical Group explain how they can handle everything from pediatrics to geriatrics, rheumatology to oncology, all under one group. Dr. Ella, a lot of times when people feel like they need medical care, they think we need to go to the hospital. Not necessarily the hospital. And then other times people have a tough time finding the type of doctor that they need for the specific issue they're having. Genesis Medical Group is a purposeful effort by top doctors to make sure you can make healthcare accessible.
Yes, absolutely. Genesis Medical Group, it's multi-specialty group. It's one home for family, one home for moms. And we love our moms.
Yeah.
We care about our moms.
Yeah. And you say one home for family. You address everything from pediatrics to geriatrics.
Yes, absolutely. Now we have pediatric division in the Genesis Medical Group. Now we're expanding to more and more touches for the family, so we can take care of family completely. And going back to moms, as moms get older, we want to make sure that we take care of their heart, we take care of their vaccinations. For example, shingles. At the age of 50, moms have to get shingles. Multiple reasons. It protects shingles, and there is one little side interesting fact. Shingles vaccine, there is some data showing that decreases rates of dementia.
Oh, wow.
So it's...
Guess who's going to get her shingles vaccine, right? But yeah, and it's interesting you say that, shingles vaccine. A lot of times when it comes to women, the first thing they think about is only the mammogram. But you do that too. You're an oncologist, by the way.
So we do mammogram. We want to make sure you have colonoscopies. But again, complete. We have to make sure that blood pressure is checked, cholesterol is checked. We want to make sure that heart and everything related, we need to make sure it's all complete package. We cannot just look at one small organ and say, that's it, you're done, you're good.
Yeah.
We, at Genesis, we want to make sure you are completely covered.
Yeah, in fact, heart disease is the #1 killer of men and women around the world, and oftentimes we think of it as a male issue, but it's not. All right, Marshonda, when it comes to breast cancer awareness, so many women, we think, okay, October, I'm going in, because that's October is Breast Cancer Awareness Month, and then we miss our appointment in October, we think, okay, I'll wait until next October. Don't wait.
Absolutely. You know, the key to any disease prevention, of course, is early detection, right? So at Genesis, we definitely encourage our moms to focus on themselves, become health aware, schedule your annual wellness exams, schedule those mammograms as soon as you think about them. One of the things with insurance is now they're starting to be a little bit more lenient on timelines and windows. So not waiting until Breast Cancer Awareness Month to get those done. Get them done as soon as they pop in your mind.
You say timelines and windows, and part of that is I know at one time there was some discussion about at what age somebody should go in and get a mammogram, a woman should go in and get a mammogram. But the key is if you're noticing changes in your body or you know something is wrong, go in then. Don't wait till a certain age.
Absolutely. If you notice any changes, as soon as you are aware of those changes, contact your provider.
All right, Dr. Ella, I've had people say, well, breast cancer doesn't run anywhere in my family, so I don't have to worry about it.
Yeah, but most breast cancer happens spontaneously. You do need to check, and as Shanda said, if you feel some lump, just check it out, see what it is.
Yeah.
Do not wait. Early detection is paramount. It cures lives. Why go through chemotherapy and everything else when you can avoid it by simple test and maybe a smaller surgery?
Yeah. You know, contributing factors are age is one of them. The other is just being a woman. And by the way, men can get breast cancer as well if it runs strongly in your family. You know, men should get checked as well. But just being a woman, family history does play a role, but it is not as huge as many women might think. All right, symptoms we talked about early stages. Usually there's no symptoms. Same thing with heart disease. Usually no symptoms, right?
Yeah, absolutely. That's why we need mammograms. We pick up a lot of abnormalities in mammograms. Small calcification could be something that could be tested, checked, and you you're fine.
Yeah, yeah. The other thing is rheumatology. You have rheumatologists among your doctor group as well, and that is also something that is super important.
As people get older, we develop more and more rheumatological conditions. And now moms, they're also prone to develop rheumatological conditions. So at Genesis, we have very heavy emphasis in prevention and treatment of rheumatological conditions, from arthritis to anything.
Lupus.
Lupus, gout, whatever you have, we can take care of you.
Yeah, and the great thing about that is that if you're going to one specialist for one thing, that you can pick up the phone and call another specialist within the group. That is such a great asset that you all have, is that you have specialists within the group that can talk to each other and keep your health care under one roof.
Absolutely, and then having access to coordinated medical records. Everything that Dr. Ellen is able to see for a patient, our primary care physicians are able to see for the patient. So ensuring that your providers remain educated about what's taking place at the specialist level, so they can treat you and your family as well.
Yeah, yeah. When you say you and your family, I can see it right now. Hey, everyone, gather around. Let's get in the car. We're all going for our exam. But it's true, because you can do that, from the kids to your grandparents to everybody under one roof, and you can keep your medical records under one roof. I know when you ask people, where are your medical records right now? They're probably all over town, if not all over the country. Wherever you've lived, you have medical records. What a nice way to be able to put all of that under one roof, so when a doctor is asking some questions or needs to know some information, they can literally look it up under that one roof.
Absolutely, and it makes it makes it a lot easier for the patient to coordinate and be a part of their own care experience.
Yeah, yeah, and of course the other thing that makes it convenient is that you have several locations throughout the greater Houston area. Thank you all so much for helping moms be healthy. Because if mom's not healthy and happy, guess what? Nobody in the house is going to be healthy and happy.
That's absolutely true.
Audience member said that's right. All right, to book an appointment, call 281-440-5300. Again, that number is 281-440-5300, or visit genesisdoctors.com.